This Good to Go segment is sponsored by Spectrum Health Medical Group.
We are fortunate in our community to have 24-hour emergency services for serious, unexpected illnesses and injuries. But the follow-up care you receive after your ER visit is also just as important. Dr. Todd Chassey is an emergency room physician at Spectrum Health in Grand Rapids, and he's here to tell us about Spectrum's ED Aftercare Clinic. Welcome, Dr. Chassey.
Catherine, thanks so much for having me.
I am glad to. What is the ED Aftercare Clinic?
This is a joint venture between Corewell and emergency care specialist. And really, we know that about 8% of patients who are seen in the emergency department end up needing to return to the emergency department within 72 hours. And so we view that as a great opportunity to offer to our patients who have been seen in the emergency department a chance to have a virtual visit with one of our emergency physicians or advanced practice providers to try and fill in the gaps between their visit and when they're able to follow up with their primary care provider.
I had never heard of this. When did you start offering it?
We started this in March of 2022, and so we've had a lot of success so far, and we're just glad that we've been able to roll this out.
And talk a bit about the benefits of the clinic.
I think the biggest benefit for our patients, again, we're not trying to replace primary care, but some of our patients don't have access to primary care, or there's a gap before they're going to be able to follow up with their primary care provider. And some of the opportunities that we found when you're in the emergency department, there's a lot of information and it's a very busy time. And many of our patients, after they get home, may have additional questions or want more information about what had happened during their visit. So a lot of what we've been able to provide to the patients is education and information to complete their visit. Some of our other patients have noticed that they've needed a medication change or have had other issues that we're able to address before they're able to follow up with a primary care provider.
So is it the folks who don't have a primary care provider that you want to see in that clinic, or is really anybody who comes through the emergency department okay for that?
Yeah, great question. This is for any patient who's been seen in one of our emergency departments. And we thought that we would get a lot of patients who did not have a primary care provider. We've been pleasantly surprised to see that many of our patients actually do have a primary care provider, but even for those patients, there's often a gap before they're able to follow up, or they have a need that comes up when they aren't able to see their primary care provider. So we've been able to offer this service to a wide variety of patients, both those with primary care and without primary care.
Are there limitations or cost involved?
Great question. This is billed the same way as if you had followed up with a virtual visit with your primary care provider. So it's an office-based visit that is billed to the patient's insurance. We do have other limitations. At this time, we're only seeing adult patients. Again, we hope to be able to expand the service beyond adult patients who are seen at one of the Corewell West Hospital emergency departments.
Anyone else offering a similar program?
I think that's one of the interesting parts about our program. Telehealth providers, there's many of those throughout the country. I think the unique aspect here is we're actually linking you with emergency care physicians and advanced practice providers who were part of the team that had cared for you initially. And so I think that's the unique spin that we're able to offer in service versus all of the telehealth providers that are out there. This is a local service with local providers.
Well, I know I've been there myself. You go to the emergency room, it's chaotic and confusing sometimes, and you walk out like, well, what's next? Well, the what's next, you guys have figured that out and are providing a lot of peace of mind, which is a wonderful thing. Thank you for that.
No, it's our pleasure. We just want to create value and help our patients. And so we're happy to be doing this service.
All right, folks, if you'd like for more information, we'll put a link on our website, 13onyourside.com. Dr. Chassey, thank you.
Thank you so much.